Hi, and welcome to Pennsylvania Newsmakers, and thanks for watching. Well, the politics and the campaigns are over. We're now going to return to our regular programming, as they say, and what two better subjects to start with than health care and housing. We're going to do some updates on those important subjects after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host.
Hi, welcome back to Pennsylvania Newsmakers. Well, joining me, as often is the case, is Carolyn Scanlan. She's the president and CEO of the Hospital and Healthsystem Association of Pennsylvania. And Carolyn is going to smile because I got it right. I haven't done that over the years. Carolyn is one of our experts we call in from time to chat with us about health care. She is an authority on a whole variety of health care subjects. We're delighted to have her on. Carolyn, welcome as always.
Thank you,
now,
Terry.
I got one right, and I won't call you Catherine anymore. At any rate, it's always I'm delighted to have you here. Look, we got a bunch of things to talk about today, but I'm not going to let this program get by without asking you, from your vantage point, what you see as the implications in the recent elections for hospitals. There are big implications for everybody. What do you see? What do you see in the General Assembly of Pennsylvania in particular, and the governor and the relationship?
Well, in the state legislature, based on who retired,
right,
was not reelected, and the new people coming in, we see it'll probably be a little more conservative, a little more fiscally sensitive.
Right.
We know that the governor has talked during the campaign and even on election night about broadening insurance for the uninsured.
Mm-hmm.
This year we saw Cover All Kids get enacted. Right. And so there may be some polarization between the legislature and the governor around health care and health care issues.
Yeah, I think you're right about that. One of the things that we've been hearing is that there may well be a program to extend health care coverage, not just to a few. I mean, the governor, I think, on occasions has said a few, and then on other occasions, many. And we have, the estimates vary, maybe as many as 1 million Pennsylvanians that at one time or another do not have health care coverage. So to do that, you're right. I mean, somebody's going to have to pay for that, and that's not going to be easy to do, is it?
No, it's not. And it's even a little more than 1 million now. It's probably 1.2 million
right,
of our fellow Pennsylvanians who don't have insurance. It is expensive. The state budget, as you know, is always a difficult place to try to fund these kinds of issues. The Cover All Kids started off modestly, so they were able to do that funding. And I think the debate will be, where does the money come from?
Right. Good point, and we'll have to see. I know we have one model now, the Massachusetts plan, which is still in its infancy, and it does place the burden on the business community pretty heavily up there. We'll have to see. You're right, with more conservatives in the legislature, if the House remains Republican, and that's still somewhat in doubt, the next couple of weeks that will get ironed out. We will see.
I want to make a point, though. I think it is an appropriate conversation to have, and at the Hospital Association, we would support all individuals having health insurance.
Sure.
We've talked in the past about how people without insurance delay their health care, the problems that it develops. It is the right conversation to have in the state.
And it may be that it's a program that starts out a little modest and then grows as the CHIP program and other programs have, but you're absolutely right. I mean, we ought not shy away from the important discussion. All right, also in the last couple of weeks, we've been hearing more and more about the Healthcare Cost Containment Council and something that is known as the Acquired Infection Report. And this is, I think, a requirement now in state law. You'll straighten out the facts if I get them wrong, where hospitals have to report infections. And this has become a pretty big issue, and not so much issue as when these releases are, they get a lot of publicity. First of all, talk a little bit about why you think reporting these hospital infections are important.
Well, hospitals internally have always tracked infections that patients contract while they're in the hospitals.
Right.
And they're called healthcare or hospital-acquired infections. What this report that the council released yesterday does is it gives to the public that very same information, information that the hospitals have reported to the council, is now released in this annual report of all infections that the hospitals reported for 2005. Now, what it shows is that of the almost 2 million patients that hospitals took care of, a little more than 1% contracted infections while in the hospital. That's pretty significant for each and every one of those patients, and it categorizes it by every hospital in the state. And so if you're a patient or a family and you're either entered the hospital through an emergency or you have a planned visit, you should be able to understand what can happen to you when you go into the hospital, not only for the repair of whatever the problem is, but also what other consequences could happen. And we have a website called Care for PA. Patients and families and any Pennsylvanians, and for that matter anyone, can go on that website and get information about what you should be asking your doctor, your nurse, the hospital, and what you should be expecting in the way of the right kind of care.
Okay, we're going to take a quick break. When we come back, I'm going to continue with this. I have a couple questions. Healthcare Cost Containment Council, tracking infections, why that's important to you. More on that subject after these words.
This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education, 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania, and by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to Pennsylvania Newsmakers with Carolyn Scanlan. She's the president and CEO of the Hospital and Health System Association of Pennsylvania. We're talking about the recently released report on the state tracking acquired hospital infections. This is mandated in law. Carolyn and I have chatted about this over the years. All right, Carolyn, let's go to... Now, I want to get one thing straight with you. Because hospitals get some infections doesn't mean they're bad hospitals. No. I mean, let's go into that, because I think that's important.
It is. There are lots of infections now, germs, that have an antibiotic resistance.
Sure.
And so when your resistance is low, when you have a trauma or you're sick, you have a tendency to contract these infections, and the hospital is an aggregation of all of those sick people. To the extent that in this report, the council did not include people who are in hospitals for burns or for transplants, because those individuals are highly susceptible to infections. Having said that, however, there are things that hospitals can do to try to create better environments to minimize or eliminate infections.
And the bottom line is that when you all were working with the Healthcare Cost Containment Council, that's the state entity that's responsible for this report, you all, I mean, you worked out now an accommodation over what gets reported and how it gets reported. Is that correct? I mean, that's pretty important.
It is, and you know, we continue to try to work towards the statistical way in which the data is looked at. There will continue to be conversations around that. Infection disease physicians, infection control practitioners, statisticians, all want to continue to look at the data to try to understand it.
Okay, now let's go to another subject that we have talked with on any number of occasions, and this is a very important subject because it concerns, in a sense, the insurance that doctors get. It's kind of a Medigap insurance between two ranges of cost of coverage, and this is pretty important because, as you know, with lawsuits against physicians and the premium increases that we've seen over the years, although I take it they've leveled off a bit, the state has jumped in over the years to provide what's known as Mcare Abatement. Now, explain that in language that our viewers can understand and why it's important to them.
When hospitals or doctors go to buy medical liability insurance, they get it from two different places. They buy it in the marketplace, or they self-insure themselves to up to $500,000. and then the state provides the insurance through the Mcare fund for that layer between $500 and $1 million, and then hospitals oftentimes go buy additional insurance for $1 million or more above that. The Mcare fund is the place where there has been an abatement of the premiums that physicians have had to pay. Some physicians have had 100% abatement, meaning they don't have to pay any, and some 50% abatement. The funds come from a cigarette tax and an auto cat fund. When you get a speeding ticket, there's a surcharge in there.
There you go.
Part of that surcharge goes to offset the liability insurance, this cat fund.
Now, let me ask you this question. There is an unfunded liability as a result of the payment that the state makes to cover these premiums, I'll put it that way. If I'm wrong, you can straighten me out. And something has to be done to deal with that unfunded liability. Am I correct?
You're absolutely correct. What we and the physicians, the medical society, are advocating is for that Mcare fund to be eliminated over time, probably by the year 2010, 2012.
Okay.
And when we do that, there's $2 billion worth of claims that need to be funded.
Okay.
And so there is an Mcare commission that is looking at making recommendations on how to move towards eliminating that Mcare fund and using that same funding source, the cigarette tax and the auto cat fund, to pay for that unfunded liability.
And just to conclude with this, and that would be a permanent fix as opposed, you're looking for a permanent fix.
Rather than this year-to-year.
Year-to-year thing, which the legislature has to renew every year.
Now, yes. Now, why this is important to the viewers is that it makes a more predictable environment for physicians, and we're concerned about attracting and keeping physicians in this state, and that access to care is important, and you need your physicians in order to get care.
Okay, great update. Thanks for coming on. All right, when we return, housing. I think the market interest rates, it all looks pretty good, but I'll tell you, we're going to bring some people on who know a lot more about this than I do when we return.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source.
This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to Pennsylvania Newsmakers. Well, we're doing a healthcare update. Now we're going to do a housing update. The 2H updates. I like that. And as often is the case, we're going to turn to the Pennsylvania Builders Association for one of our periodic updates on the health of the housing industry in the state of Pennsylvania and a couple of other issues. Joining me, as often has been the case during the course of the past year, is Brad Elliot. He's the 2006 president of the PA Builders Association. All right, Brad, let's go to the heart of it. First of all, welcome.
Oh, thanks. It's always a pleasure to be here.
And we're always happy to have you here. All right, look, you saw me in my intro. Maybe I'm crazy, and you're going to help me out here. I happen to think this is not a bad market if you're thinking about buying a house. Interest rates are still low. Relatively low. You've got, housing construction going up here and there. You got a lot of redevelopment going on in the cities. Am I crazy? Am I right or am I wrong?
No, you're not crazy, and that's why I wanted to come in here and speak about this. Pennsylvania's housing economy is not in a slump. It's more of a turn back to normal conditions after after a huge bump in 2004 and 2005. But I feel sometimes out in the media, it's like the Chicken Little thing going on, that the sky's falling, and it's just not the case.
Yeah, and so the housing market was moving along, and then it had this huge uptick, right? Huge uptick.
In 2004 and 5.
Yeah, and now it's going back to where, still growing, but maybe not growing as fast, and so...
Well, it's still growing.
It's still growing.
And I think what's happened, and what we've seen a little in the media in the last couple months, was a reaction to the national market. The studies I've seen show that we have housing starts predicted for the next 10 years of 1.7 to 1.8 million a year. In 04 and 05, we were over 2 million. So nationally, we definitely overheated in some markets, and they're recovering right now and getting back to normal. Pennsylvania, on the other hand, I don't know any of my fellow builders that would say Pennsylvania ever had a bubble.
Yeah.
And that's due to a couple factors. One is we have a very tight regulatory environment here. So it takes a lot of effort to get a piece of ground approved for a new community, and then after that to get it permitted through the state agencies. So there's always in our area a lack of supply, as far as we can see, for the pent-up demand for new homes.
Right. Well, your industry, I think typically we might think of your industry as filled with, lots of large, home builders, but in reality, you're essentially, you have some, but you're also filled with lots of small business folks, right? These are just small...
Oh, absolutely. Our organization is mostly comprised of home builders that build 5 to 10 homes a year and have a dollar volume of $1 million or less. So from their perspective, if they build 6 homes this year as compared to 7 last year, that's not a slump for them. The other thing, Terry, I did bring a chart just to compare ourselves to 2006 to 2003.
The chart is on the screen.
There it is.
Go ahead.
2003 was a normal year. If you ask anybody in the industry in Pennsylvania how they did in 2003, they'll say that was a great year for home building. But as you look at the chart, there's 4, in this case, of the 8 counties, 4 are a little below 2003 starts through September, and 4 are above. But like Lancaster's 2% below, but York County's 9% above 2003.
So it looks like we've got about 20,187 building permits versus about 18,000, just to round it off, so it's about 2,000.
Yeah, it's a little down compared to 2003, but a lot of this, I think by the time we get to the end of the year, we've already seen signs that the housing market's increasing.
All right, so just before we go into another topic, something else that I want to ask you about, about is it a seller or buyer's market, something I want to talk with you about. The conclusion is simple, that housing is not in a slump. Number 2, you believe that it's sort of reverting back to...
We're getting back to our normal
to your normal pace,
which is good for everybody.
Okay, good for everybody. All right. Brad Elliott's with me. We're going to come back. I'm going to ask Brad, and this is something you might be interested in. Buyer, seller, what kind of a market is it? Maybe it depends where you live, but maybe it depends what you want to do, but it might not be a bad time to buy a house. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Builders Association, building today for a better tomorrow, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hey, welcome back to Pennsylvania Newsmakers with Brad Elliot. He's the president of the Pennsylvania Builders Association. We're getting a little update on the housing market, as we often do. All right, look, let me make this point to you, and you tell me whether I'm right or wrong. First of all, everybody has to make their own personal decision about whether they can afford and whether they can buy a house, right? It's all internal, family finances, needs, and all that.
Right.
But the big question is, if you're thinking about it, is this a buyer's market? I mean, should anyone objectively say now maybe is a good time to buy a house?
Well, in my opinion, Terry, it's the best time to buy a house, probably in the next 10 years. As you know, real estate goes through cycles. We just came off probably the top of a price cycle, and we're getting back to normal. Things are relaxed. We're going to go through another one of those cycles. This is a buyer's market. It's the time to get out there. I mean, mortgage rates are at historically low levels. They're 6.5%
Right.
for a 30-year fixed, when even 6 years ago they were 8 or 8.5%.
So it's like we were talking about earlier, where we had where we had the boom. The interest rates were lower then, but as participating in the boom with low inflation rates around the country. But what you're saying is inflation rates by historic standards are still pretty good. When I noticed we had almost 15% interest rates in the mid-1980s. I remember that. I don't want to remember that.
Yeah, I didn't have to buy a house then, luckily.
I don't want to remember that. All right. So I want to talk about something else. I read as I look at a newspaper that the prices of houses seem to have leveled off, and even in some places have dropped. So that's another reason, right?
Well, I think in Pennsylvania they stabilized.
Yeah.
I don't think they're dropping here in Pennsylvania because there's too much lack of supply to allow the price to drop. But what has happened is the frenzy has come out of the market, which is great for buyers, because now buyers have the opportunity to really shop around. There are builders that are
But prices aren't going up the way they were.
No, but they're still going up, but at a more normal level.
Okay.
But the key is you're out there, and what I think as a builder personally is I have an opportunity now to really work with my buyers and give them the opportunity to customize their home, build the home of their dreams. Whereas when the market's overheated or frenzy, you're just doing whatever you can to keep up. So
in
the
other words,
buyer's in a great position right now.
And that means something that you all call incentives, discounted financing packages, as well as other things that you can work with the home buyer on. Is that your point?
Well, my point is builders are always doing what they can in any market to sell more homes. But right now the buyers have a great opportunity to get the builder's attention and to really find the lot they're looking for, find the new home design, and then customize it to their lifestyle.
We have about 45 seconds, but I want to ask you another question. You have another point here that I think you've made in some of your literature. Houses are staying on the market longer, meaning more choices for you. What's that mean?
It just means it means if I go look at a home as a new home buyer, I don't need to worry that tomorrow it's going to be sold. I can go down the street, check out another, come back the next day, and then put down my deposit. So
I got it.
The market, it's a normal market, and builders have the time to spend with their buyers and help them build what their dream is.
Good update. Thanks for coming on. At some point, I want to get into this mass transit stuff and the realty transfer tax. We can do that on a subsequent show.
Oh, I'd love to do that.
See you next week. Another edition of Pennsylvania Newsmakers. Stay well.